Hi, I'm Kathleen Keller from Keller Method Vitality, and I am a myofascial educator. I teach self-myofascial release, and I'm also a rehabilitative Pilates practitioner. And I'm here to show you a technique to do with the 5-inch self-myofascial release ball. So when we're doing work in the spine, anywhere in the spine, we do not want to be aggressive with any kind of tool that you're using. So all you need is just a needle nose of the needle and pop it into the ball. And then you're just going to take quite a bit of air out of your ball. We want it to be quite soft. And you'll know when you get on it that you still need to take air out, because you will go, and it'll be too much. Okay, so I'm going to try that. So before we do this technique, it's a thoracic spine technique. Before we do it, I want you to know where your thoracic spine is. So if you landmark about 2 inches above your belly button, that's where your thoracic spine starts, and then it ends right at the base of your neck. So everything in between there is fair game for us to release. So before you do this, I really recommend that you do some sort of before and after, a comparative, so that you can see and feel what you did. Otherwise, sometimes your body doesn't really know. So this just helps your central nervous system realize what you did. So I'm sitting on a bit of a block, and that's just so that I can sit up as tall as I can on my sit bones. If you tend to sit with your tailbone tucked a little bit, you're definitely going to want something underneath your booty. And we're just making sure that we are sitting on top of the sit bones. Again, this is a thoracic spine mobilization technique, so I don't want you to sit with your booty out like a J-Lo butt with an arch in your low back, and I don't want you to tuck your tailbone underneath like a bad dog bum, trying to sit right on top of your sit bones. The main thing is, when we do this comparative, is that you don't arch your low back. We're just trying to get a sense of what your thoracic spine feels like. So we're going to interlace the fingers. The thumbs are free. The hands are going to come behind the back of the neck, and just kind of take your pinkies and put them under the ridge of your skull, under the suboccipital ridge, and give yourself a little bit of a traction. Settle back on your sit bones, and then on an inhale, you're just going to lift your breastbone up to the ceiling as much as you can. Gaze strongly upwards, because that tells your spine where you're going, and just notice what you see, because you're going to do this again afterwards. So just landmark, what do you see on the ceiling? How far did your spine go? Then come back down. Then we're just going to cross the hands across the chest, and we're going to do a simple thoracic rotation, because your thoracic rotation is also going to increase with this release. We're going to rotate the thoracic spine. So my pelvis stays facing front. I've rotated everything from my belly button up, but I don't want you to really turn your head, because that'll give you a false sense of rotation. Try and keep your chin in line with your breastbone. That's my true thoracic rotation ability right now. And then again, you landmark, you see what you're looking at. And then we'll do the same thing on the other side. Try and keep your chin in line with your breastbone. Rotate that spine. Make sure the pelvis stays facing head. And again, you're landmarking. What do you see? And you're noticing how your spine feels. Back to the center. And now we'll do the technique. So make sure that you have a couple of props with you, a yoga block, some sort of a pillow. Have 2 of them just in case you need them. You're likely going to need 1 for sure. So we're going to landmark where the thoracic spine begins, which is 2 inches above your belly button, and you're going to put the ball where that would come out the other side in your spine. And you're going to lie down on your floor, and then you're just going to see that as soon as I lie down, that I need something underneath my head. That's hyperextension of my neck, and we don't want that. So I'm going to put a little dog bone pillow underneath my head. And then for some people, it might be too much, and you might need a little bit of a pillow or even a folded towel underneath your booty. So you can decide that, because what we don't want is a big, huge arch in the low back. We just want you to feel like you're getting a nice thoracic extension from the belly button up, but you don't feel any strain or pain in your low back. So that's super important. Now we're simply just going to lie here and feel what you're doing. Where the ball is right now, just above the belly button, that's actually where your diaphragm, the legs of your diaphragm, attach to this specific area in your spine. So just take a moment here and think about breathing into the spine. Creating space from the inside. We're affecting all sorts of muscles, including the diaphragm. And you just take a moment and settle in and see how it feels. Now we're going to be doing some, I call water spine movements. It's an image I use to help evoke movements in the spine that the spine wouldn't normally do. So if you imagine your spine made of water, because there is a lot of water in your spine, your cerebral spinal fluid, we're going to move that water. So the idea of dropping a pebble, if I dropped a pebble from the ceiling into your spine made of water, just see if you can make a little circle with your spine. So my pelvis isn't really moving. My rib cage has to move because it's attached to my spine, but you're really trying to use the ball as the fulcrum to do some movement in the spine. So I call that one the pebble drop. We're mobilizing those thoracic vertebrae. And then another image is a kayak. See if you imagine an oar of a kayak goes down into the water and then it comes up and over and down into the water and up and over like that. If I do that movement in my spine, that's what it would look like, down and up and over. Or you could think about it as a sideways figure 8 or an infinity sign, where we're just trying to evoke some movement in the spine, get all the fascia moving around, all that connective tissue, getting some juice. And then the third image I use is a wave. So you think about a crest and a fall of a wave, just like you would think a wave feels going through your body, up and down and over. I don't know if you can see that, but that's the idea that we're trying to evoke. So we're going to take that idea further up the spine. And when we move, if you're lying on a mat, you can actually just hold onto your mat and you can pull with your feet and do a little kind of a bum walk. And now I'm moving the ball up higher than it was before. I make sure that I take my prop with me for my head. My head's comfortable, and again, the low back's comfortable. And then we do those same ideas. So I've got that pebble drop. That's that circular motion, those kind of concentric circles around. Then I've got the kayak, which is that up and over. So it's actually a rotation of the thoracic spine. And you're really just trying to move and use the ball as a fulcrum. Let the ball help to do this movement. And then the last one is the wave. And you could make stuff up. It's just an idea to help evoke movements in the spine in the way that the spine normally never gets to move. This is flexion and extension of the spine. And then when I move again, I'm just going to wiggle down a little bit. I do a little bum walk. I hang on to my mat. I bring my head prop with me. I could just relax and just breathe. You don't have to do any movement. You could just be here. It's a beautiful thoracic extension. And again, it should feel good. If it doesn't, take some air out of your ball or put a different prop underneath, but just breathe and enjoy it. Once we get up higher in the spine and we're more around the shoulder blade area, we can also do arm movements. So there's this I call cactus arms, so that both of arms are just in an L shape. So that's an external rotation of my shoulder girdle or an internal rotation of my shoulder girdle. So this is just moving my humerus bone, my upper arm bone inside the socket. But that's going to affect, because the arms fascially attach into the spine, that's going to affect the spine as well. You could give yourself a big hug, take your arms, you could do your kayak this way. And we've got the pebble drop again, we've got those big circles. Any kind of movement. Another movement would be a lateral movement, like a snake going through water. This would be a lateral shifting of the vertebrae. Again, just using the ball as a fulcrum. And you're just slowly going up your spine and doing all sorts of feel-good things. And I'm going to move up again. I just do a little wiggle walk, little bum walk. Take my head prop with me. Now I'm properly in between my shoulder blades. And once you're in between the shoulder blades, it's delicious. There's all sorts of things you can do. So I call these reaches. Reach the arms up to the ceiling, so my shoulder blades are separating away from my spine. I'm protracting my shoulders. And if I want, I could squeeze the ball between my shoulder blades, so I'm retracting the shoulder blades. So I'm really getting a lovely massage of the rhomboids as well as the mid-trapezius muscles. Another one is scissors. That's where one arm goes overhead and the other one comes down by your side. And when you're doing these type of movements, you really want to think about the movement coming from your shoulder blades. So if I do it from my shoulder blades, this is what it looks like. But if I do it from my arms, this is what it looks like. So it's very different. You're not moving your arms. Your arms are just the passengers. You want to move the shoulder blade up towards your ears so that you're really getting all that juicy, all those delicious layers because you're moving the bone out of the way. That's the scissors. Then I'm going to move up again. I'm about, depending on how long your shoulder blades are, you've got a low and a middle and a high position for the ball to be in between the shoulder blades. We could do just arms overhead. You can hang out anywhere that you want. If you take your arms overhead, that's actually a nice pec major stretch because the pec major attaches fascially into your upper arm bone here, into a little groove in your upper arm bone here. And the pec tendon doesn't actually untwist unless the arms are fully overhead. So that's a nice thing to do. And you can make stuff up. I can just take my arm across. I can do a little bit of rotation in the spine. Once you're laying on the ball, you'll know what to do. You want to do things that feel good, taking the arm across, rotating the trunk a little bit. Now I'm coming up one more time. I'm going to be finishing off. So I'm going to be finishing right at the base of my neck where the shoulder blades finish, at the top of the shoulder blades. Simple things like a shrug will feel good. And again, you may want to make sure that you're moving your shoulder blades. The arms are just the passengers coming for a ride. We could do circles. If I put my palms just on top of the shoulder blades, and again, I'm moving my shoulder blades. It's not my arms. I'm really moving those blades. The shoulder blades should glide and slide along your rib cage. They should be able to move. They should be able to elevate and depress. And we're going to call that done. So when you come off, lie on your side and use your hands to come up. Take your time. Your head comes up last. And then we'll revisit the comparative. So now we are redoing the comparative that you did before. And remember, this is really important because it helps your central nervous system know what you actually did. So if you sat on a block, sit on the block again. If you were cross-legged, sit the same way that you did, or long legs, however you sat. And make sure you're sitting in the same relative spot on your mat because you're going to be looking up at the ceiling and you want to be having the same comparative. Hands go behind the back of the neck. And you snuggle the pinky fingers underneath the neck. You make sure that you're not arched with your low back, nor are you tucked with your low back. It's just a thoracic extension. And you're going to inhale and lift the spine up and just see if you go farther than you did before. Whatever you landmarked on the ceiling, hopefully you have gone past that landmark because you've actually increased your thoracic extension. And then we'll also do the rotation. So that's the hands across the chest. Make sure you keep your chin in line with your breastbone so that it's a thoracic test, not a neck rotation. And then I'm rotating my thoracic spine. And I already know that I got maybe about, 10 degrees more thoracic spine rotation from that. And then I'm going to do the other side and see what I got. I got a little bit less. I maybe got 5 degrees, but I did get a little bit more thoracic rotation on that side. And thoracic rotation is something that we all lack, as well as thoracic extension. So this is a great technique to do at the end of the day to unwind your spine from a long day of sitting or working.